Hello friends, this is a case demonstrating the use of the B-Hex ring in a rigid, non-dilating pupil with a soft cataract. Before the use of the B-Hex ring, it is necessary to stretch the pupil, but one must be warned against doing an overzealous stretching. A minimum stretching of the pupil is enough. The B-Hex ring is inserted into the anterior chamber with the help of the B-Hex forceps, and the first flange is inserted under the iris. In a smaller pupil, inserting the flange can be a challenge, and one can be helped by the use of the B-Hex forceps and by the use of the other hand to fixate and maneuver the globe. The third flange may require you to stretch the B-Hex ring quite a lot to get it under the iris, but it has a very flexible nature and a good memory. It is necessary to make sure that the alternate flanges are above the iris. The ring enables a convenient rhexis, which should be straddling the pupillary margin. The hydrodissection has to be gentle and in small parts, with simultaneously decompressing the bag so that the ring does not get dislodged. In a soft cataract, one has to ensure that there has been a good rotation. One tip would be to finish off all the chopping maneuvers before one starts emulsifying the pieces, so that we do not dislodge the pupil dilating or the pupil retaining device during those maneuvers. In a softer cataract with the Ozil machine, I prefer to do a 4-quadrant technique. So I complete all my 4 quadrants, and then very often, even with a one-handed technique, we can emulsify the pieces in the iris plane as demonstrated here. This is completing the 4 quadrants first, following which it becomes easy to get the pieces outside the bag and aspirate them. Too much maneuvering in the anterior chamber may often dislodge the ring, so that is why I prefer to use this technique. Though this may not be a fully dilated pupil, but it generally gives you an adequate size pupil to complete your case comfortably. The lens has to be inserted in the bag in a gentle manner, again so as to not dislodge the ring. And personally, I prefer to flex the trailing haptic rather than dial it in, so that the haptic does not pull along the B-Hex ring flange. Once the lens is in the bag, with the same Krugler hook, we can dislodge the B-Hex ring into the anterior chamber. We can remove the B-Hex ring with the B-Hex forceps either through the main wound, or in case there is iris prolapsing and blocking the main wound, this maneuver may be done through the side port as well. The ring has ensured a comfortable cataract and complete removal of cortex. At the end of the procedure, I personally prefer to get down the pupil with a little dilute pilocarpine, and because of the gentle stretching, we have only a few sphincter tears and the pupillary diameter is not much disturbed.